We'd like to go ahead and get started. Thank you all for coming. I think everybody here knows me at this point. I'm Judith Rosenbaum. I'm the facilitator for the research community. And today we have with us Ms. Gillian Jaeger, I'm sorry, who is coming down from Washington, D.C., where she works as a consultant. She has, we were just talking about this, 27 years in the Navy. Don't mess with her. She will make us all do. But, and where she works in healthcare administration. She went to work for TRICARE, then became a lobbyist, and now has her own consulting agency. She's been meeting with some of us. She's very knowledgeable about federal funding. So if you have any questions, write them down. She'll be more than happy to answer them for you. For now, I'll hand the floor over to you. Thank you.
Good afternoon. Can you all hear me? Good. I've got a bit of a sinus infection, so I can't hear myself very well. So if I come across like I'm yelling, I apologize for that. I'd like to thank you all for being here today, and lots of familiar faces in the audience. I've worked with ASU for about 4 years as a consultant to ASU, and was very involved with working with the folks at OSRP, Casey Chan, Scott, a lot of you folks, and enjoy the time that I worked with you to collaborate and see how we can get some research funds to ASU. Then we kind of hit and we severed and went our different ways, and I'm just thrilled to be back here at ASU. And I hope that going forward we can find ways to collaborate and work together. I helped once, just so you know. So I got a phone call that says, hey, can you come talk to us about health disparities research? I never turned up an opportunity to come to Albany. I must be crazy, because most people don't like to come all the way to Albany. They stop in Atlanta. And I was so proud of myself yesterday because I drove without any directions, and I found my way back here, back to the hotel. I was like, yes, I know how to do this. So again, thank you for the opportunity for being here. So I was asked if I could come talk to you a little bit about health disparities research, and I think the timing is really good to talk about health disparities research. Many of you know what health disparities is, so I don't want to insult you, but I thought we'd spend a few minutes and talk a little bit about the history and the first attempt at the official definition, which was developed in 1999 in response to a White House initiative. And NIH, under the direction of Dr. Barmas, they convened a working group, and they developed the first NIH definition of health disparities. So health disparities are basically differences in the incidences, prevalence, mortality, burden of diseases, and other adverse conditions that exist among specific population groups in the United States. And that should be near and dear to your heart here in Southwest Georgia, because without giving you a lot of statistics, I happen to know that health disparities is very well and alive here in Southwest Georgia. So in 2002, there was a public law known as Minority Health and Health Disparities Research Act, which was authorized by NIH on minority health and health disparities, and that, in fact, became the legal definition of health disparities. A population, if there's significant disparity, as we said, prevalence, morbidity, mortality, minority health, it just doesn't, a lot of folks don't realize that it is public law, and that, all of this is very much still alive and really led to some of what's going on right now with the Affordable Care Act. It played a role in the development of the Affordable Care Act. And I'll talk a little bit more about that. So I won't read this to you. Different public and different private agencies, NIH, HHS, DHS, DOD, they all have some form of health disparity research focus. So if you're looking for funding opportunities with respect to health disparity, don't just look under NIH. Cast that net out and see where there might be some opportunities. As I said earlier, there are a number of factors that contribute to health disparities. And I think for you here in rural Georgia, you happen to have a lot of these factors, which for that reason I think health disparities should be of extreme interest to you. There are people in Washington, D.C., there are folks in Montana, in other places that are doing health disparities research. But I think who better than you to do health disparities research? Because you're in that incubator, you're in that environment. You're rural, you have the minorities, you have the elderly, so you have all of those factors. And so I would say health disparities research is something that Albany State University should be very much interested in doing. And I hope I don't get you in trouble for saying that, but that's just my personal feeling. So since the law, there's been a number of revisions with respect to what makes up a health disparity population. And so at first the focus was African Americans. But now, as you can see, there's a lot of broader interpretations, and it does include Native Hawaiian, Pacific Islanders, American Indians. And what that means to you is that there's more competition for the dollars. There's more competition for the dollars. So you can't become complacent and assume that because you are in this community and that you have all these factors, that by virtue of putting a proposal together, you're going to be more successful than others. This is just something that you need to be very aware of. This is in fact your competition when proposals are submitted for health disparity research. So earlier, I had a series of meetings with some folks here, and it became quite apparent that there is a clear need for more knowledge here at ASU about the health disparities statistics for Southwest Georgia. If you live here and if you're interested in doing research, you should know what this information is, or what this data is. What I have here for you today is in fact just some broad statistics. So when you write a proposal, yes, broad statistics are relevant, but you've got to make that passionate case for Southwest Georgia. So what are those factors? And we'll get there as an institution, because that should be something that each and every one of you should know. You should know the health disparities statistics for Southwest Georgia. It should be visible on your institution, in your institution, for people to see it, so people are aware of it and become compassionate about trying to make a difference. So in general, as you can see here, the picture is very grim for African Americans and health disparity nationwide. And those statistics appear to be getting higher and higher. But I'm particularly interested, and you should be as well, as to what those statistics are. And my hope is that the next presentation, the focus will be specifically on the health disparities in Southwest Georgia. So who funds health disparities research? NIH? Absolutely. Do they have a lot of money? Absolutely. And there are a lot of sub-organizations under NIH that funds health disparities research. The Department of Health and Human Services? Yes. Office of Minority Health, HRSA, SAMHSA, I mean, you name it. They're all funding health disparities research. And going forward, they're going to be particularly more interested in health disparities research because it is those evidence-based and outcomes-based research that's going to tell them whether the Affordable Care Act is making a difference. So for you here in Southwest Georgia, I encourage you to do research on health disparities so that you can track and monitor. Is the access to care really making a difference with prevention? Is it making a difference with early detection for cancer? Is it really making a difference in prostate cancer. So all of those things. And the Department of Defense, we'll talk about that a little bit later on. But they have a significant amount of money under the congressionally directed medical research program, and also the peer-reviewed medical research program, where they put out requests for proposals for for research. Now, if you reel back a few years ago, DOD had, and some of the other agencies, a specific pot of research dollars for historically black colleges and universities. Congress, in their infamous wisdom, decided they weren't going to do that anymore. So what that means is that organizations like DOD, when they put out a broad area announcement for prostate cancer or for breast cancer, you can submit a proposal that's health disparities sort of focused but tied into that topic. So it doesn't mean that you can no longer compete. Yes, you can compete. You can compete with a health disparities focus, or you can compete with a regular focus doing breast cancer research. And later on we'll talk about what it is these folks are looking for in proposals. What makes your proposal competitive? Also under AHRQ, the National Library of Medicine, oops, I'm going a little bit too fast here. The Centers for Disease Control, which happens to be right in, not too far from you guys in Atlanta. Go up there, talk to the folks that are doing research. Find out what it is they're really focused on. What would be of interest? I will tell you that in almost every circle that I've been, not just the health disparities research, but any kind of research, what they're looking for is collaboration. Collaboration with other organizations, other universities, the private sector. And some folks call that triple helix. You know, there's different names that they give to it. But the bottom line is the federal government has been investing billions of dollars in research. And so there's a sense among some of the folks that are providing this money that they're not seeing the great return on investment that they think they should be seeing. But that they believe that if there is greater collaboration among, all these different organizations, you're more likely to have better outcomes and make more progress. So what I'm saying to you is, when you're thinking about writing a proposal, you have to take your blinders off and you have to think about the broader community, the greater good. Reach out. I know that Judith has a lot of contacts in the local community. If you're doing health disparities research, you've got to include the folks that are doing the public health activities out there. Reach out to Phoebe Health System. And they're also looking at, within the university setting, is there interdisciplinary collaboration? So you're doing health disparities research. Are the nursing folks involved? So they want to see more collaboration, and I think that just makes an awful lot of sense. So with any organization, one of the things I encourage you to do at the beginning of the year, when you start thinking about what is going to be your research focus, you need to take a look at the organization's strategic priorities. Because it's not about what you want, it's about what they want. It's about what their focus is all about. So for example, I thought I would look at the NIH's strategic priorities. NIH has decided, and their strategic plans, most of these organizations are online. So you can go look at it. And for them, prevention research areas for investment and expansion, best available methods in prevention research, as I said, collaboration in preventive research projects. For years, the physicians have been telling us, you can study healthcare and all of these diseases until the cows come home. But if you don't have prevention in place, we're not going to make any inroads. And finally, after decades, people are starting to listen and to understand that the only way we're going to save money and we're going to make a difference in the lives of people with respect to healthcare is to focus on prevention. So NIH, as the nation's health institution, has decided that's where their focus is going to be. Evidence-based interventions promote the conduct of implementation and dissemination of research and prevention. Again, I mean, that to me hits home. It just makes a lot of sense that the focus be there. So I was happy to see that. NIH, of course, wants to, at the end of the day, this increases their visibility and their focus. The world knows that they're focusing on prevention. The Office of Minority Health, and many of you have contacts there, administers programs to facilitate community linkages and strategies. Again, if you're submitting a health disparities research project, Phoebe Hospital is submitting one, somebody else in the community is submitting one, they begin to say, how are these folks going to make an impact from a community standpoint if they can't come together? And no one says it, you know, from time to time, yes, but if repeatedly you see that, you begin to understand that there's not a collaborative community focus. So, I guess you can take the lead, but you've got to have partnerships with respect to going forward with health disparities research. And again, the National Institute for Minority Health, their program and projects, they have collective programs with 200 sites around. They're looking at, and you can see here, workforce development, biological to health systems, extramural research program, again, you know, looking for cooperative awards to individuals. I will tell you that the word data is becoming quite popular, not only in the world of information technology, but in the world of health research. So when you begin to put a project together, not only looking at the data to make the case, but looking at the data as an intricate part of the study and going forward. Those things are extremely essential, because at the end of the day, we all know we are a data-driven society. We're going to continue to go in that direction. So I'm not sure, I'm not knowledgeable as to whether there is a focus here on this campus with respect to health informatics or health data. Maybe the folks in the nursing degree program may be focused on nursing informatics. But see how you can interweave some of that and into a proposal to be competitive. So extramural research programs, lots of funding opportunity. I just wanted to list some of them for you. One of the things that's on here is scientific conferences. I encourage you all to go. The value is not just, if you're going to a conference just to get information, then you're going for the wrong reason. If you're going to a conference, you're going to establish new relationships. Be strategic about it when you go there. Who is it you need to connect with? Who from what institution that's been successful in winning grants and contracts that you can get on that pony and win something? That's what you want. The folks that are the presenters, the folks that are managing these programs, make a point when you get there to connect with that individual. So find yourself at those conferences, but just don't go to take notes. You've got to be strategic about it. You've got to make sure you're meeting with the right people, both from the participants as well as the presenters. So under the fiscal year 2014 management plan for grant awards, I thought I would share with you what NIH has sort of put together as far as then where they're going to put money for FY 2014. So non-competing continuation awards will be funded at 100%. If you have an existing grant with them, that is their plan. They've committed to that level. going beyond, in 2015 and beyond, it will remain unchanged. The folks on Capitol Hill recognize that research is very important to this country. And so, though there's a lot of bickering back and forth, and you hear it all the time, at the end of the day, you will see there is still a good level of commitment to fund research, because research is what makes this country great. So keep an eye on where things are being funded and where things are not being funded. So new programs, commitments, so new programs are where the challenges are. And you see that in any federal agency. It's easy for Congress to say, I gave you $400 million for last year, I'm going to give you another $400 million this year, as opposed to I'm going to give you $500 million. So in that regard, sequestration and all the bickering that we have regarding money has impacted us to some degree, in that we're not seeing a whole lot of growth in funding dollars. DOD did get some addition, but at the end of the day, what you're going to see is a lot of continuation at the same level. Somebody asked me earlier about SBIR and STTR research, and I'm not sure, has anybody in here ever been funded under a Small Business Innovative Research? Okay. Well, if it's something that you're interested in, all of the agencies have a pot of money for Small Business Innovative Research. And I was talking to, I think, Casey Chan earlier, and he told me about Dr. Sedair, I think, who has developed this medical device for measuring DNA. You know, it's those kinds of innovative things that if you have something, you can put a proposal together and you can pursue some SBIR funding. And SBIR funding is typically open-ended, so you don't always have to wait for an RFP to come to fruition. That's the other thing. For almost everything, by the time you see an announcement for a particular research, if that is the time you're trying to decide to put a proposal together, you're somewhat behind the curve a little bit. So if research is always about thinking ahead, it's like they funded this last year, well, it's very likely they're going to fund it this year. So, you know, the proposal was due in July. February is not too early for us to start collectively coming together and coming up with a plan. So you can pretty much plan for the future based on what happened, you know, in previous years. So keep that in mind. No inflationary increases for future year commitments for competing grants and awards in FY 2014. Basically, I've told you there's no additional money. They'll continue to support new investigators. And again, let me back up a little bit. So, you know, a lot of times when I talk about research, I tend to talk about research for the institution, research programs, but there's always research funding for faculty as well. So lots of fellowship opportunities. NIH is funding things right now on biomedical research excellence, alcohol and HIV/AIDS, definitely a problem in the African American community, so it could be a health disparities focus. The Center to Reduce Cancer Health Disparities, that's a focus. I'm not sure what the statistics is here in Southwest Georgia, but I would bet that it's not good. So that could certainly be an area for you all to consider. They fund quite a bit, and so they're looking for innovative research proposals. Again, they're looking for collaborative research studies. I can't think of anybody in any of these agencies that are not looking for collaborative research. And I say collaborative, I mean collaborative local, collaborative outside, HBCU to non-HBCU. You know, they're looking for things that make sense. And I know it's hard, because when you put those kinds of proposals together, you need strong letters of support from every one of the players. And you need to make sure that not because somebody comes to you and says, hey, we're doing X, Y, and Z, you have to look at them from a strategic standpoint. Does it make sense? Or is there somebody else that will be a better partner? I also understand that, Hampton University just got something like $60 million for doing some collaborative research projects.
Hampton and Langston.
And Langston. So they want to become our next best friends. Seriously. I mean, and I know that you all are submitting a proposal, but gotta cultivate that relationship. And that's the strategy the federal government is going to. They are doing it with non-medical contracts. They have these things called IDIQs, and they want these big Goliath things, and then they're allowing those big contracts to then, send out the individual, small contracts. And they feel like with research, they'll be better able to look at outcomes and look at data and see if any of it makes any sense. So I encourage you to build relationships with them. So the cancer research portfolio, basic, clinical, translational, a lot of talk about translational research. And if you pick up any journal and you read it, everybody wants to know, we're doing research, what's going to happen with the evidence and the outcomes, and how can we then translate that into making better clinical guidelines for preventive care, for cancer, or for whatever the disease is that you're studying. So you'll see a lot of that, and a lot of focus on that when you're looking at cancer and health disparities. Prostate cancer, as you know, the statistics for minorities are pretty bad. DOD has an open broad area announcement for prostate cancer research. So from a health disparities focus, that might be something that you want to think about. NCI believes also in training students and investigators from diverse populations that will be part of the next generation of competitive research. Casey and I have been talking about the Remy grant and how some of that may apply to them. Okay. So I've said much of that. So this, in summation, is kind of like, at the end of the day, the cancer focus at NIH is really trying to say that you've got to partner and come together with different entities if we're really going to make an impact in doing cancer research. So that's basically what that says. Just sort of take for granted. But when you're thinking about health disparities research, you really have to, what are you studying? What it is you're hoping, sometimes we have these grandiose ideas, but we don't kind of pull it all together. Are we looking at causes? Are we looking at, when we're done, what solutions we can apply? How are we going to make an impact? And I would really say that type of creative and strategic thinking happens when you bring a group of people together. And this is why they like the interdisciplinary focus. So if you've got an idea and you think it's going to be great, reach out to 4 or 5 and say, hey, let's talk about this. Because it's that kind of collaboration internally that people can see through in a proposal, that you've given it some thought and you just didn't go off in a corner and write that for yourself. The idea is on reducing health gaps among groups. If you're not talking about reducing health gaps, then you're missing something. That's really important. Let's see, I'll let you take a look at this on your own. But the bottom line is some of this is pretty much, I got a little carried away with my slides here. I love slides. So, informatics approaches, research on health disparities involving innovative development, scientific methodologies, network analysis, social network analytic methods. Again, social network, social media, all of that is playing a significant role and will continue to play a significant role as you go forward in research. And with respect to health disparities, people are, when you put a proposal together and you're just thinking about, holding a meeting and educating people, that's gone. That's gone. You got to start thinking outside the box and think about, how do you drive that information to somebody's personal health record or electronic medical record, or what app you're going to be, would be there for it. You have to think of what's happening today with data and what might be happening in the future with data. And really understand that data plays an essential role. Extramural programs, tons of opportunities here for you guys. I'm going to, with respect to the National Medicine, National Library of Medicine in DC, if you're ever there, stop by and talk to those folks. They have funding opportunities, tons of them as well, and there's a point of contact there. AHRQ, a lot of folks, these folks are pretty much into looking at data and looking at outcomes, because a lot of what they do really improves clinical guidelines and how people are treated with respect to healthcare. So go online and take a look. AHRQ puts out a lot of RFPs as well, looking at how minorities are disproportionately affected. They have ongoing funding, dissertations, fellowships, all kinds of opportunities. So don't, like I said, underestimate an opportunity that might be there. The congressionally directed medical research, that's the DoD program. Go online, learn as much as you can about them. Again, you would wonder, why in the world is DoD studying breast cancer, prostate cancer? Because it impacts their community, and their community is not just the uniform folks, but their beneficiaries as well. In fact, at Walter Reed and Bethesda, they have a breast cancer center, which was funded by Congress. And they're always trying to figure out how do you make the population healthy. I think it was Dr. Thomas told me he was studying, doing a research project on the SAMHSA for suicide prevention. And he's going to SAMHSA to give a presentation. And I said, I hope you're also going to DoD with that presentation. Interestingly enough, his cohort, he has about 140 veterans in there. And you have to tell that story. You have to take that state story to DoD, because DoD is very interested in suicide prevention. If you haven't been paying attention to the news, during the Iraq and Afghanistan war, the rates of suicide just skyrocketed, and the rates within the military is still significantly high. So they're always looking to find better ways of addressing that problem. So there's a lot of Congress, I think last year it was $400 million under the CDMRP, Congressionally Directed Medical Research Program. There is a person there at DoD, Dr. Teresa Miller. She handles health disparities issue. And I talked to her before coming out here, and I said, so Teresa, what's important to you guys with respect to health disparities research? And she says, we have no specific topic. It's how the proposal is written. So if you submit one for prostate cancer, breast cancer, whatever it is, and it's health disparity, and you're making a very compelling case, you're going to get funded. So I just wanted to share that with you. So they have, they look for innovative research, high impact research, consumer participation at each level. What's interesting here is that they will use ordinary people as well as scientists and others to help evaluate those proposals. I've encouraged others here at ASU, if you want to get on those research panels at NIH, or I think you should. ASU should have a handful of people that are participating in some of those evaluations. That in turn helps you because you sort of have a seat at the table. Unique characteristics. They're looking for consumer involvement, disease-specific, novel funding mechanisms, no standing review panels. I think I mentioned that. And it's relevant to the needs of research and patient communities. So this is a program that's been going on. It's been funded, I said, since 1992. In 1993, it was $210 million. Last year, it was $400 million. And as you can see, it started off with things just as neurofibromatosis, prostate cancer, Gulf War, and it has grown. They even have funding now for arthritis. One of my clients is the Arthritis Foundation. And over the last few years, they've gotten $1 million to do arthritis research. And you say, arthritis, why in the world is DOD studying arthritis? Well, if you think about it, disability ratings for the military, arthritis is one of the highest percentage. So, these guys run all the time, and gals, they walk, they carry 60-pound packs, they develop arthritis in their backs. And so government's paying out substantial disability ratings for veterans with arthritis. So if we can study arthritis and try to figure out is it something we can help prevent early on, then it's worth spending the money. So that's why that focus is there. Peer-reviewed medical research program, that's another program of funding opportunities. So go on the DOD website for peer-reviewed medical research and congressionally directed research. Always check their broad area announcements, see what's out there, figure out if that's something you want to do, figure out what your team should look like, and is this something you should be going after. And don't hesitate to call the program managers. You know, people who get funded are people who have relationships with the folks within the agency. So make that effort and do that. And as I said, Congress has been funding this program and will continue to fund it. So, and I told you all of this about the history, so I'm not going to repeat all of this to you. Again, they're all looking for better clinical guidelines, a way they can provide better devices, better drugs, earlier diagnosis, and it's only research that's going to get them there. Congress continues to fund these programs, and for that reason, I think if this institution is going to go do research, you're going to have to figure out, you know, whether you want to play or not. So a good snapshot of what's been going on within these programs. Take a look at this. This is the kind of money that the federal government has been investing on the CDMRP with respect to funding. And look at the amount of applications they get. A lot. A lot. A lot. So if you're going to spend the time putting something together, make sure you're doing it right because the competition is fierce. And, you know, like I said, I've worked with ASU in past years as a consultant and also worked as a lobbyist for you all to get federal funds to the institution. And in collaboration with working with Congressman Bishop and your other delegation, we were able to bring some money here to start some new programs. And that money fell under the program of earmarks. And then earmarks became a dirty word back in 2008 and 2009. And earmarks went away. So earmarks didn't just go away for ASU, it went away for everybody. Penn State, UCLA, all the big guys, the little guys, everybody. It's gone. What that means is those folks have now turned their focus to these competitive grants and other funding mechanisms. They were doing it before. They're doing it even more now. Okay? So, you know, you have to figure out that the competition is fierce and you can get there, but you're going to get there through collaborative partnerships and relationships with academia, industry, and others. So, again, the funding process, just so you know, Congress approves it. They then, you know, everybody waits for their budget to come 1 September. Then they release the program announcements. They do the peer review. And then, as you can see here, you know, all the vetting goes on. This process looks cute on this chart, but it is a long process, right? It is so frustrating sometimes to just wait and wait and wait. But, you know, we all have to know what the process looks like. There's a two-tier process, scientific review and programmatic review. I encourage you guys, again, as I said, to volunteer, some of you to participate and do some of the scientific peer review. I think one of the good things about being a reviewer is that you begin to understand what a winning proposal looks like. And so I've sat on some source selection boards for contracts as well as reviewing proposals, and that's how you learn. And you begin to say, whoa, I thought I was writing a good proposal, but look at this. These guys are innovative. Look, you know, how organized and how presentation is everything, for the first thing. you know, the spelling, the looks, the whole bit. But then you start looking at content, and there are points given, you know, for everything. Somebody said to me the other day, not the other day, but earlier today, that in one of your grants that you're no longer being funded, the outcomes was not where the agency thought that it should have been. There wasn't enough data. And they believe that's why there's no more future funding. My comeback to that was, you gotta go see those people. And you can make a case, you can talk to them. Oftentimes people just want communications. So you've had a change in leadership, you've had a change in program management, or whatever it is. But by you getting up and going to see them, I think you begin to make a good case. This is just, I mentioned to you that the peer reviewed is panels. They have consumer advocates, scientists, from academia and industry. There's no standing panel. They're looking for every year like 30% for new reviewers, so don't be shy, okay? So let's see, then they have an inquiry review panel. I won't read that to you. The bottom line is go to their website. According, you know, to a lot of their materials, and I'm over there, CMRP is at Fort Detrick in Maryland. What I have said to people that I talked to here earlier, if you're coming to Washington, D.C., or you're going any place, you have to maximize the use of your time. So you're going to SAMHSA to do a presentation, and you're going there for a day. Why are you going there just for a day? Maybe you need to go there for 2 days. And while you're there, you go to SAMHSA, but who else can you see while you're there? You're coming all the way from here. And then what are you trying to achieve when you go there? What message do you want to leave them with? And so I encourage you to do that. For the people in DC, it means a lot when you make an effort to come and see them and to tell that story. I've seen it. I'm not telling you this because I'm just blowing smoke. I'm telling you this because I know it works. So, it seems only fitting that we've talked about agency and health disparities research and their approach and where there might be some money and all of that. It just seems to me that this conversation wouldn't be complete if we didn't talk a little bit about health reform and health disparities. So, we all know that the quality of life, lack of access, all of that led to healthcare reform, as in my view, as it should. The bottom line is that if the Healthcare Reform Act did not look at how we can improve poorer outcomes, how we can improve health overall and in general, then we would miss something. So I encourage you here in this area to focus on health disparities. I think it's most fitting that you begin to look at, you know, is this access, is this education, is any of this going to make a difference? And the only way you're going to know that, you can't do it by word of mouth. You have to look at evidence-based and you have to look at data. And who better than an academic institution to partner with others to focus on that? So, other steps for reducing healthcare disparities includes focusing on training healthcare providers, recruiting diverse healthcare workforce, eliminating language barriers, coordinated community-based programs. I throw this out here to you because those are things that you can read in and can focus on as you decide what area of healthcare disparities you are going to study and research. It is so, the elephant is so big, the problem is so large. And so if you start writing a paper and you start talking about how you're going to solve world hunger, you're not going to be successful. So you have to figure out what specific area, and then who are you going to collaborate with, and what do you hope to achieve with the evidence and the outcomes that you find, and make that compelling story. Evidence suggests that communication, trust, and understanding are greatly improved between a physician and patient when they share the same ethnic, cultural, or primary language background. Some will argue about that. Data collection, we talked a little bit about it, how important data collection is and is going to be going forward. I'm not sure. If you're going to do health disparities, I need you to really check with your nursing folks on are they doing data collection? And when you do a project, you need to have some data collection focus. So your role is essential. If you're going to shine some light and you're going to show any progress in the future, studying health disparities will make a difference. I want to share with you, and because I want to spend a little time answering some questions, so I just roll through those slides and you can go back and take a look at it. But how can you contribute to health disparities? I want to make sure that that's what we're talking about here today. How can you make a difference in health disparities research? Well, to me, institutional research focus is imperative. I'll say it again. Institutional research focus is imperative. The leadership, the culture has to come from the top, but you have to grow it all and around, and you have to get people excited. We're making a difference in the lives in our community. We're focused on health disparities. Institutional incentive to encourage research, that's critical. I hear that all the time from different institutions. We don't feel like there's enough of an incentive. There may be some incentive for me to do one little grant and I get X, Y, and Z out of it. But we've got to stop thinking about us individually. We have to start thinking about us as a broader community. And I shouldn't be preaching to you because you wouldn't be doing what you do as faculty. First of all, the reason you're here is because of who you are, and you care about the students, and you care about the greater good of society. So to me, this is an easy one for you all to kind of wrap your head around it. You're here to make a difference. So research must be a part of ASU's business model. Why? Some will argue you're not a research organization. I say bullpucky. And the reason I say that is because, yes, you're not a Harvard, you're not, a UCLA or one of these institutions or Penn State that have these robust research programs, but you should be doing some level of research, or you should have a plan as to what level of research you want to do so that you can impact your local community. And to me, health disparities fits nicely into that. Research impacts recruitment and it impacts retention. So I think we're kidding ourselves if you say you're not a research institution. If you hear of somebody doing research, pat them on the back. And I've told folks in here earlier today, one of the problems is that you do research, but you don't tell anybody. You don't market it. You don't tell the folks on the campus, this is what we've done. The guys that are in forensics and criminal justice, they've done some great research. But you've got to market it, you've got to get people excited, you've got to tell them what you're doing so they see values, so they see ASU, your brand is not just about being a teaching institution, but your brand is also that you care about your local community and you're collaborating and doing some level of research. So, market your research success, build cooperative partnerships with the local community, local industry. I was talking to Scott earlier, and he and I share a lot of similar thoughts on research. And we agree that if you look at the successful institutions around the country that do research, they have collaborative relationships with their local companies, organizations, and they have relationships with other universities, whether it be Big Brother, Middle Sister, whatever it is. So here at ASU, we've got this wonderful lab that was funded by REMI, a research lab. And as Scott and others have said, they understand we need to bring people here to ASU from perhaps Miller Coors or other places. What problems are they experiencing that they may appreciate a small research focus by ASU? And the rewards from that is a long-term sustainable relationship. They might even put some funds towards something. The other thing that may do is create an opportunity for students and faculty to collaborate with that entity. So don't underestimate that, and that requires a plan. So building relationships with other universities and institutions, I know you've done that before. I know that folks are trying to build relationships with Hampton and Norfolk, and all the folks that seem to be leading the pack with research, and I applaud you for that, and I think that you're headed in the right direction. And I want to thank you guys for the opportunity to come here today and to share this with you.